Hello and welcome to Inside Healthcare. The Minnesota Health Commissioner, Jan Malcolm, calls COVID-19 the biggest health issue here in the world and also in Minnesota. These are challenging times for those mentally and physically for many people, but especially for those living with dementia. And we're very pleased to have back with us Ruth Haleman for some advice on caring for those living with dementia. So again, I apologize on the last name pronunciation. But great to have you back, Ruth.
It is really wonderful to be back in the studio.
Yeah, it's been a while. So before we get into some of the advice on caring for those living with dementia, what is dementia for people that may not be familiar with it? What does dementia mean?
How is dementia different from just normal everyday forgetting?
Yes.
Yeah. Well, dementia is actually a larger term for diseases of the brain. And the way it's different from normal aging and normal forgetting is that it is something that interferes with the activities of daily living. So, meaning that it's going to have an impact on how somebody is actually getting around in their day. Family members start to see symptoms of it. So it's a disease of the brain, and there's quite a few different types of dementia, Alzheimer's being the largest, but there's also vascular dementia, Lewy body, a number of different kinds, frontal temporal, and a bunch of them. So.
And I can't imagine, how is COVID impacting individuals with dementia right now, almost 2 years in?
2 years into it?
Into it, yeah.
Yeah, I think the hardest part has been for family members and to not be able to see their family members, for one thing, from the perspective of being in a community. Of course, visitation has certainly opened up quite a bit, but when it first came down, when COVID kind of closed everything up, initially, it was very hard on families, and it was extremely hard on the family members that were in communities. I think a lot of people experienced that.
And that social connectedness, I think, is so important, that human contact and stuff like that.
Yeah, absolutely. And I think, we've all experienced that lack of human contact and being able to go out and be free out in society and do the things that we always love to do. Now we get to think about it, and when we do get to do small things, it's really exciting.
Absolutely.
And
yeah.
But for people with dementia, it was really a challenge, and it has been a long time. And a lot of people saw their loved ones decline, whether they were in their own home or even in a community. That social isolation piece is really strong. We're really we're pack animals, so to speak.
And this month we have Thanksgiving, coming. So what would be some of that advice and tips that you would give to families, someone, their loved one, their husband, their wife, their adult
For sure, yeah.
parents or grandparents, what kind of advice would you give to them?
Well, I think, mainly to keep your expectations in perspective. So being able to have a family gathering, which might be the first one you've had since COVID, and there can be some really big ramifications for that. If you have a loved one that has had dementia and you've got family members coming in that haven't seen them, it can be really a shock to see the difference from the time that they had last connected. And so there's preparing your family members as to what they might encounter. Large gatherings can be really hard for those on the journey of dementia, and depending on how they operate in a crowd, it can be almost overwhelming. And so it's important to think about how you're going to celebrate the holiday with your loved one and protect them from becoming agitated or having trouble taking it all in. So giving them lots of space, and sometimes keeping the numbers low of people that you invite. And instead of it being a big family gathering, maybe a couple of smaller ones is also an idea.
More of a one-on-one sort of a situation?
Yeah.
What would be some of those other challenging things for someone with dementia during the holidays?
Well, it's again, the expectations, but we always want to do things like get up and go to places, go to concerts, and to do lots of things, prepare with gifts, and sometimes simple is better with people who have dementia, because we want to pay attention really much more to the moments of contact. Those are the precious things with someone who has dementia. And all of the bells and the whistles and the presents and all of those things are important, but they're embellishments to what is really important, which is that connection that you have, that heart-to-heart piece. Sometimes just going through an old photo album, things like that, it can just really be a heartfelt experience. Let them reminisce, putting on Christmas carols and singing Christmas carols, or even the act of baking cookies and letting them stir the batter.
Oh, great
or
advice.
roll the cookie dough. It's not going to be perfect, and that's the beauty of it. You're giving your loved one an experience that they can handle, and it's literally, those are the memories that you'll have.
And keep them short, right?
Keep activities short, yeah, to what they can tolerate, and give lots of time for rest and time for exercise, and time for yourself if you're the caregiver, to give yourself time to be not a caregiver and enlist the help of family members.
Or maybe offer help, like I can care for mom and dad tonight if you want to take an evening off or something like that.
Exactly, yeah. I think tag teaming is really a great art for family members.
And we're going into the winter months as well, and then with the COVID and stuff still around, any other advice that people should be aware of, especially if they're caring for a loved one or that sort of thing?
Yeah, and I can relate to this because my dad is 91, and we want to keep him safe. He's had all the vaccines, the booster, and still I'm wary of him being out in crowds. We're still wearing masks. Use good hygiene. Use that hand sanitizer. Keep that social distancing going. Even with family members, try to avoid the physical touch, as hard as it is.
I keep wanting to hug people.
I know.
And I have to just pause.
I know it, and I feel literally bad about it, and I crave that connection. But an elbow bump is better than nothing. So I do a lot of elbow bumps.
Oh, and also you're with Artist Senior Living Facility or Center, and then you care for people with memory loss and stuff like that. So, and how are you seeing the residents? How are they doing this period of time?
I love that. We are actually really fortunate right now. Our community is doing very well. We've never had COVID in the building, knock on wood. And so we've taken a lot of precautions. We do have visitation with family. The great thing is that our community focuses on providing an enriched environment for family members. And we want to make sure that they feel like they've got things to do that are important, that they're productive, that they're still connected to the larger community. So we want to make sure that the activities or the programming that we do gives them that opportunity.
What kinds of things would those programming entail and stuff like that?
Well, we like to tailor them kind of individually. So if we have one gal right now who is a really good cook, and she likes to do it's baking with this resident, and it's just like a baking show. Oh. And all the residents sit and watch her bake, and then they get to try all of the baking.
Oh, that's wonderful.
It's just delightful because you can see it in her face that this is really important, and then you see it in all of the other residents. So that's just a tiny example of things we like to do.
Final comments for our viewers that we want to leave with them, with the holidays coming up and COVID and dementia and all of that.
You know, I think you can plan and plan and plan and try to make it a perfect holiday for everybody, but the end thing is that there's going to be things that go wrong, pies that don't bake and turkeys that get left in the oven for too long, and just go with the flow, enjoy the moments. These are the moments we have. I think we're all really much more cognizant from 2 years ago of what moments really mean now.
Well, wonderful advice as always. We're so glad to have you back here with us here in the studio.
Thank you so much for your time.
Thank you so much, and we'll be back with more right after this.
When times get dark, we can't see the help that's all around us. Let 211 be your guiding light for help with food, healthcare, and other resources.
211, how can I help you?
Call 211 or visit 211.org. 211, get connected, get help.
Welcome back to Inside Healthcare. Joining us now, we're very pleased to have back with us also Jessica Francis with the Christian Covered Emergency Food Shelf, the CCEFS. So thank you to be back with you. I think it's been about 6 months since you've been with us.
That's right, that's right.
So before we get into some of the programs, some of the things that you're doing with Thanksgiving coming up, we want to make sure we get that out. How are things? I feel like you have a window to our community. What is happening with our families and kids right now with COVID still lingering here going into the holiday weekend, holiday season and stuff like that?
Yeah, thanks so much for having me. I'm happy to talk with you about what we're seeing at the food shelf. And we've been seeing a real increase in the number of families that are coming to see us just in the last maybe about 6 weeks. The numbers have started to really increase, and we expect that those numbers are going to stay high, through the holiday season, because they traditionally do. I think a lot of it is, a lot of families are still recovering from what's been happening for the last year and a half, and then the rising costs of food and of fuel and heating costs and everything are really catching up to families and making it so that they really need our help to make ends meet.
Well, thank goodness that you're able there to help out families and stuff like that. When we were on last time, we were talking about today's harvest. How's that going? You had just launched, I think, when you were here last time.
Yes, I think I was here right on our first day or right around that.
Something like that.
And the Today's Harvest Market has been just really, really well received. And we had expected that we would be serving about 80 families a day there, and we are serving usually at least 200, if not 220 families a day at that market. And so it's really just helping to meet that need and making that food really accessible. So, we pick it up from the grocery stores in the morning. This is good, healthy food that the grocery stores are taking off the shelves because it's getting close to the end of its life. But we pick it up and make it available to the community. And we've just found tremendous success in being able to get that food, save it from being wasted, and get it out into the community.
And are there plans to expand or change the program since you started and things like that?
Well, definitely, and we haven't even been open for 6 months, and we're already seeing so much interest in it. So we're definitely looking at lots of different ways that we can expand it and have even more of a presence for it.
And really a first of its kind sort of thing in the Twin Cities, right? To have a market like that? That's
right, and we're really excited that a lot of other food shelves are asking to come and see it and take a tour and learn more about it, because they think that this is a great way of serving their community too. So we're happy to kind of be starting something new right here in Oakdale.
And you have a campaign that you had launched a couple of months ago now called More Than a Meal. What's that all about?
Yeah, so the More Than a Meal campaign is really about how food is about so much more than the ingredients that go together to make a meal, or the health and nutrition. We all know the importance of that, but it's often so much more than a meal. So a lot of our really important memories and important family memories and stories are really about food or involve food, whether it's memories of your grandma teaching you how to make a special recipe, or
Yeah, especially being Italian. I sat down with my grandma learning to do some of her recipes and stuff, so which was exciting, and I still have those memories, and I have the recipe written down. And
yeah, so many of us have those memories, whether it's a big meal for a holiday with everyone gathered together. So the more than a meal is really saying that by donating or helping to volunteer at the food shelves, you can provide more than a meal. You can provide those memories and those special community events and family memories for families in our community.
what a wonderful campaign, and that's continuing and things like that, and how people can participate in that if they'd like to share their stories.
Yeah, so that is largely from our Facebook page, and so we encourage people to share a memory that you have about food and a special memory to you. And Securian Financial will donate $10 to us for every person that shares that memory.
Oh, nice.
So with that donation, then we're able to make those memories for others in our community.
And $10 means a lot. I mean, that can feed how many meals or families? Or I know the
Right.
numbers are amazing.
We can obtain 100 pounds of food.
Wow.
For that $10, and so with that 100 pounds of food, then we can make provide the food for all of these families in our community to make their special family meals.
And going into Thanksgiving this month, the holidays right behind that, how do we help families and kids right now so that really no child should go hungry during this time of all times? It seems like there should never be a time, but
Yeah, I mean, I think it's so important to know how that you can connect with helping with hunger in the community. So whether it's volunteering, I know our food shelf is always looking for volunteers, or donating to help support. The financial donations are so helpful because then we can go out to the food banks and get the food that we need the most at a really low cost. Or the food donations help us fill in, those other areas and provide those items to our community. So I think that there's lots of really wonderful ways for everyone to get involved. But it's also about telling people that it's okay to ask for help.
I think that is probably the biggest challenge for some families in particular and stuff like that.
Mm-hmm. Yeah, it's really okay to come and ask for help, get the food that you need, and you'll be back on your feet in no time, and you can pay it forward later. But just knowing that families can go to us and non-judgmental, we'll get them the food that they need. That's a really important thing for people to know.
We have just a couple of minutes left. So quickly, you have a drive-through program. People just drive up, no answers, no questions. If they need some food.
Yep, we through our drive-up programs, we ask as few questions as we can, and we don't require appointments. We don't require people to bring any documentation. Try to make it as simple and easy as possible for people to get the food that they need. Or they can go to our Today's Harvest market, and you can actually park, shop, pick out the items that you need. So we're really just trying to provide food in as many ways as we can.
And it's not food that people have just totally decided. I mean, this is healthy, it's fresh, it's everything that you might need to put a meal on the table and stuff like that.
Yeah, that's right. And right now with our programs, we're serving over 2,000 families a week through all of the programs that we've got, and the food is there. So we're happy to get it out to the folks that can need it.
NCCEFS is located in Oakdale?
Mm-hmm. That's right. Yeah, we're located on the property of Guardian Angels Church in Oakdale, and then Today's Harvest is by 694 in Century Avenue.
Well, we want everyone to have a wonderful Thanksgiving and a holiday, so Jessica, always great to have you on the program, so thank you.
Thank
and
you
thank
so
you for
much.
what you're doing. So
Thank you very much.
thanks. We'll be back with one more, so stay with us.
Started to panic. Was he being too pushy? Maybe it was too
Hey, sorry I didn't respond. I was driving. I would love to go on a date. How does tonight sound?
Brandon tried to play it cool, but inside he knew. A girl so smart, so responsible. She must be a keeper.
The opioid crisis has skyrocketed across the U.S. and in Minnesota. The CDC reported last month a record high of more than 96,000 opiate overdose deaths in a 12-month period. Josiah was an All-American who started taking painkillers in college. 4 years ago, he died of an opiate overdose at the age of 25. His parents, Maria and Jason, are sharing their heartbreaking story in a new national documentary on the opiate crisis and addiction.
We're all perfect in this town. High upon my head sits my crown. But that don't matter now. Just laid my oldest boy in the ground.
Josiah was a perfect student and child.
He ended up acing his ACT, got a 100% score on his ACTs.
It's a hat trick, and that's when you get 3 goals a game. And Josiah had a few of those.
Could tell that his appearance was kind of like changing.
I never saw him as someone that dabbled in drugs.
When we saw him, we knew that we were in for a long haul.
My heart sinking and just thinking, oh my goodness, what's going on?
January 23rd, 2018.
The worst day of my entire life. That positioning of him is forever embedded in my head and my memory.
And I think the peace is knowing that his struggle's over. His fight with the devil's over.
Hard drugs like that is all the way is this. And I was sitting here talking about it.
I've been in police work for over 30 years, and this one has a different feel to it, and I think a lot of it is because of how deep the roots ran.
Pain meds that were prescribed by physicians, they were being overprescribed.
And we were constantly being told it's unacceptable for your patients to have pain.
We need a rehab facility here. We need it for our community. There's so much that is going on with our epidemic.
As soon as people feel what opiates feel like, you just can't get away from it. It puts its claws into you.
The synthetics that are going around now, it has become Russian roulette.
2 things happen. Either they finally get their life together and finally follow and practice a program, or they die.
For me, watching other people that have gone through it and seeing how their lives have changed negatively because of drugs and alcohol really helped me to realize how dangerous they can be.
He was on opiates and he was high and he fell off a 2-story building and hit his head real bad and he died. He bled out of his head.
Last year, more people died from overdoses than the Vietnam War. So if you put that into perspective for a moment.
He led the life of the all-American kid. As soon as he got into opiates, he lost everything.
In the beginning of our journey with Josiah, it was extremely lonely. There is 1% recovery rate for heroin IV users. Stop funding their death. Stop spewing hate all over them. If you have an addict, chances are you've been stolen blind.
Josiah's parents, Maria and Jason, will be here in Minnesota for a premiere of that screening of the documentary Josiah, which will be held on Tuesday, November 16th at 7 p.m. at the Woodbury 10 Theaters in Woodbury. Well, that is our program for you. Join us next time on Inside Healthcare. We'll see you then. Stay safe, everyone.